The role of community in HIV prevention and testing is central to meet the fast-track targets and end AIDS epidemic. Community-driven approach enables in creating demand and deliver the quality services through supporting health systems and reaching out those most at risk of HIV. In most Asian countries, there are limited initiatives on community-led testing, community-led initiatives, and community monitoring on the quality of service delivery to encourage testing and improve treatment access, retention, and viral load suppression. With the understanding that community system strengthening is the key pillar of the strategic objective to build resilient and sustainable systems for health, design and implementation of the Global Fund's Key Population Research and Advocacy Project, or KPRA, is based on the unique ability of the key population or KP community to identify, understand, and respond to the needs of those who are deprived, marginalized, and vulnerable. A series of consultations held with key partners and stakeholders were instrumental in KPRA efforts to instigate the pilot community-led study among people who inject drugs, or PWID, and develop the study protocol, the respective standard operating procedures, and to calibrate continuum of services. The aim of the study was to improve understanding of existing HIV services and testing approaches for the key population to integrate hepatitis C or HCV screening in the recently launched HIV CLT model to improve identification of PWID infected with HIV and HCV as well as link them efficiently to treatment facilities. Overall purpose of the study was to examine the acceptability, feasibility, and effectiveness of new CLT model which integrated HIV and HCV testing and treatment. Joint efforts of National Center for AIDS and STD Control, National Public Health Laboratory, Save the Children, National Association of People Living with HIV in Nepal and its partners, Sparsha, Community Support Group and Nirnay Chitwan resulted in successful implementation of the pilot study on community-led HIV and HCV screening among PWIDs in Kathmandu, Lalitpur, Bhaktapur, Chitwan and Kaski districts of Nepal. Methods. The fundamental principle of this approach was to engage community lay providers who have no medical knowledge or degree and who are of similar past background or history of the key populations and who can act as trustable peers to KPs to reach and screen KPs in the localities using easy-to-use rapid diagnostic test or RDT kits through minimal invasion.
हामीले विभिन्न रणनीतिहरू बनाएर विभिन्न हटस्पटहरू माध्यमबाट उनीहरूलाई भेट्ने कार्य गर्ने र त्यही नै जहाँ उनीहरूलाई भेट्छौं त्यहाँ नै हामीले यो दुईटा परीक्षणहरू गर्ने.
In-reach workers or IRWs or the lay providers who received a package of training were involved in screening HIV and hepatitis C, counseling the KPs and linking them to available services like HIV treatment, care and support, including behavior change and harm reduction program services, HIV and HCV counseling, HIV confirmatory test, and sample blood collection for HCV PCR test and referral to treatment, care and support were performed through the demonstration site in the study sites. A cross-sectional operational study of community-led testing or CLT of HIV and HCV was conducted through mixed method study design by employing quantitative and qualitative approaches in 5 districts of Nepal. HIV screening and confirmatory tests were performed in accordance with the national algorithm, whereas hepatitis C screening test was done through World Health Organization pre-qualified SD Biolin HCV test kits at the same time. HIV self-testing screening through OraQuick HIV self-test kit for HIV through index testing approach was provisioned. A total of 1,029 PWID participated in the quantitative study, of which 91.6% were male and 8.4% were female. Quantitative data comprising socio-demographic and behavioral data of study participants and screening test results were collected through a structured client report form through online data collection mechanism. The participants' inclusion criteria were never tested for HIV or indicated that they had not been tested for last 12 months while practicing risk behaviors. To identify, reach and screen the PWID, the study employed various strategies that include clusters and hotspots mapping in collaboration with national program, peer educator mobilization and incentive strategy for performance-based case created a KPRA study, close messenger groups to share bottleneck and solution. Weekly data reporting and verification based on weekly performance, the performer of the week was initiated and rewarded. Visual educational material about the purpose of the study, procedures of CLT was developed and educated to the client during in-reach education. An online recording and reporting mechanism and feedback mechanism were in place. A total of 70 participants participated in the qualitative evaluation of the study, which involved an in-depth interview or IDI and 3 focus group discussion. Altogether, 70 samples were used for IDI were enrolled purposively from those participants who took part in community-led testing quantitative survey. 3 separate focus group discussions were carried out by the service providers at the study sites. Based on the themes and sub-themes identified, a coding list was prepared and the data was coded by theme and sub-theme using the computer software package MaxQDA 2020. Key findings. The study reached and screened 1,029 targeted PWIDs, of which 92% were male. More than half, 56.8%, were current drug users. 51.6% never tested for HIV, and who tested before had negative test results for HIV and HCV at least for 12 months preceding the study. Majority were engaging in risk behavior such as needle sharing and reuse of needle or syringe in last 12 months preceding the survey. Majority were reached and screened at hotspots. Most of them were using non-opioid drugs, and mean years of injecting drug was 8.4 years. Risk behavior such as needle sharing and reuse of needle or syringe had positive association with higher proportion of HCV. The results show that 20.6% were identified as HCV reactive and 0.19% were diagnosed as HIV reactive and referred for HIV confirmatory tests and for PCR RNA test for HCV reactive cases at the study demonstration sites. HCV reactive samples were sent to National Public Health Laboratory or NPHL. Out of 212 reactive samples, 203 RNA PCR have been confirmed by NPHL and further doctor consultation, and APRI score tests support were provided. Further enrollment in OST and in rehabilitation centers were also positively associated with HCV positivity, which indicates that PWIDs contracted HCV infection prior to the enrollment in harm reduction services. The study found that service receivers perceived late test providers as competent to perform the test for HIV and Hep C, also for the procedures before, during and after testing. Service recipients felt comfortable and assured by the confidential nature of the testing services provided by members of their own community. Service recipients expressed satisfaction in the convenience of being tested at a time and place of their choice, quick access to results, and the counseling sessions given by a friendly and sympathetic peer throughout the entire process of HIV and HCV testing. Additionally, both clients and lay test providers considered the cost-free HCV testing a major factor in encouraging the uptake of HIV and HCV tests. Lay providers felt that the HIV and Hep C CLT delivery model succeeded in increasing awareness in prevention of HCV and HIV among the clients and raising the importance of testing for these. The model reinforced the concept of service provision for the community by the community among PWIDs and lay providers. Finally, a strong impression from the study was that most clients who tested for HCV were anticipating the cost-free factor of the treatment. On this basis, the study concludes that in the specific study area, HIV and Hep C CLT delivery has met the needs of PWIDs who may not have previously accessed conventional HIV testing services. In conclusion, the HIV and Hep C CLT delivery model was effective in enhancing access to testing among hidden PWID groups, especially those who were not tested for HIV or HCV.
The study findings were disseminated with partners and key stakeholders, capitalizing evidence generated by this integrated CLT model. This advocacy strategy and knowledge products would be a guiding documents to utilize the study findings and recommendations during and beyond KPRA project.
Hepatitis B, C र HIV र hepatitis B, HIV र hepatitis C को पनि त्यही उसमा राखेर त्यो गाइडलाइन बनिसकेको छ, एउटा ट्रिटमेन्ट गाइडलाइन तयार भइसकेको छ, स्ट्र्याटेजिक प्लानको कुरा गर्दा स्ट्र्याटेजिक प्लान बन्ने फाइनल उसमा छ, 5 years स्ट्र्याटेजिक प्लान बन्दैछ भनेपछि त्यो एभिडेन्सले नै गर्दाखेरि आज हामी यो ठाउँमा उभिएको छौँ।
अब आएर हामीले चाहिँ यो जुन परिणाम छ यसको रिजल्ट जुन छ त्यो रिजल्टलाई बेस मानेर हामीले चाहिँ अन्तर्राष्ट्रिय स्तरमा चाहिँ सीएलटीले काम गर्छ, सीएलटी कम्युनिटी लेड टेस्टिङले काम गर्छ, संसारभरि गर्न सक्छौँ हामी र यो गर्दाखेरि चाहिँ ज्यादै मितव्ययी हुन्छ र चाहिँ धेरै ठुलो हामीले परिणाम ल्याउन सक्छौँ भनेर हामी अन्तर्राष्ट्रिय स्तरमा वकालतको प्रक्रियामा अगाडि बढ्छौँ र साथसाथै नेपाल सरकारको सम्बन्धित ठाउँलाई पनि घचघचाउने बारम्बार गरिरहन्छौँ।
Recommendations. The study has generated the evidence that support to make the strong recommendation to implement nationwide integrated CLT model to screen HIV and HCV among key populations like PWIDs in Nepal. Large-scale implementation can be one of the key strategies to achieve the goals of HIV Vision 2020, ending the AIDS epidemic as a public health threat in Nepal, which emphasizes 90-90-90 strategy for testing, treating and retaining to treatment for HIV-infected population.
जुन स्टडी भयो 5 जिल्लामा यस्तै होल नेपालमा भयो र केही फाइन्डिङ हामीलाई आयो, होल नेपालको फाइन्डिङ आयो भने हामीलाई स्वास्थ्य मन्त्रालय, एनसीएससी, एनपीएचएल हाम्रो समग्र नेपाल सरकारलाई चाहिँ हेपाटाइटिस सी को मोर्टालिटी मोर्बिडिटी घटाउनको लागि अरु फर्दर प्लानिङहरु गर्नको लागि र फर्दर अरु स्टडी गर्नको लागि पनि अवश्य पनि मद्दत मिल्छ जस्तो मलाई लाग्छ।
Similarly, implementation of this model may be helpful in achieving the goal of the global health sector strategy on viral hepatitis to eliminate hepatitis as a public health threat by 2030. Specific recommendations to specific program and institutions are listed as below. To achieve the objective of first 90 strategy, 90% of HIV-infected people know their status. This model of screening needs to be scaled up nationwide. Screening of KPs for HIV through this approach can contribute to achieve the first 90. Engagement of trained and certified IRWs rather than lab or medical personnel should be taken into consideration while scaling up the screening programs. Similarly, integration of HCV screening in the existing HIV CLT is strongly recommended. To address the family stigma on PWIDs, interventions need to be focused at families and societies of PWIDs residential areas. To eliminate HCV by 2030, develop policy, plans, strategy, and structural arrangements for preventive approaches, accessible and affordable HCV treatment in Nepal, and include CLT model in the planning and implementation for screening of HCV among PWIDs. Fear that test result would come as positive among the clients appeared in this study as one of the major threats that deter the clients from taking part in the CLT. For countering this threat, the study recommends convincing counseling session during the test, citing the facts that HIV and HCV are treatable. National program should join efforts with donors, partners, civil society and NGOs and ensure that affordable HCV treatment in Nepal is made available for those who needs it. In this study, some IRWs and clients faced police interference during the performance of CLT. So, a collaborative and a coordinated mechanism among concerned government authorities need to be developed while implementing this model. According to test and treat strategies, a free treatment is provisioned for people who tested HIV positive in Nepal. However, there is no such accessible and affordable treatment for people infected with hepatitis C. So community organizations in Nepal working in the sector of HIV, hepatitis C, and injecting drug use are recommended to advocate for the development and execution of policy, plans, strategy, and structural arrangements for accessible and affordable HCV treatment in Nepal. Donor agencies are recommended to support Nepal government and community networks through technical assistance to materialize the implementation of above recommendations. They are recommended to be engaged in the process of advocacy, planning, strategies development, implementation, monitoring, and evaluation of such programs. Additionally, they need to support in the study to generate new evidences and develop new strategies. Further studies are warranted to explore how interventional program can be designed to reduce HCV prevalence and necessary follow-up for the case.